The United States Preventive Services Task Force recently issued a truly idiotic decision. They've determined that there's not enough evidence to recommend screening for vitamin D deficiencies in the general population. And though I simply can't imagine any harm in a simple blood test that can be performed at every doctor's office in the country, let's talk about this nonsense anyway. The review looked at asymptomatic non-pregnant adults in the community, meaning they had no signs of vitamin D deficiency. But newsflash, we're all asymptomatic until we end up with something. None of these studies look directly at the benefits of screening for vitamin D deficiency. All 26 studies focused on the effectiveness of treating D deficiency with supplementation, which is interesting given the boldness of their decision. They do at least admit that treating vitamin D deficiency with supplementation appears to be safe, but that's the only bone they are prepared to throw. Rather than recommending screening for everyone, they want us to push diet and supplementation for high-risk groups. But these so-called high-risk groups include pretty much everyone, because the reality is we're all at risk for vitamin D deficiency. And I hate to break it to them, but diet is a woefully inadequate way of addressing this risk. Yes, you'll find vitamin D in some foods, but not many. That's why I always recommend vitamin D screening and supplementation to everyone. So I advise getting your blood levels of vitamin D screened every 6 months. I consider optimal levels to be between 80 and 100 nanograms per milliliter. Then, to reach those levels, I recommend a minimum of 50 micrograms or 2,000 units to 125 micrograms or 5,000 units of vitamin D3 daily. But some patients, like myself, may need as much as 250 micrograms or 10,000 units daily, which is perfectly acceptable and safe alongside regular screenings. Until next time, I'm Dr. Fred.